In March 2020, the World Health Organization declared COVID-19 a global pandemic, one we're still living in a year later, and all of our lives and our moods have definitely changed. What we thought would be just a quick break from being in the office for most of us has turned into 365 days, and grabbing a mask before heading out the door has become as normal as grabbing your phone and your keys. But we survived, we made it. Yes, we did. Lots of emotions, lots of ups and downs, but we did it. We can now look back on the past year as one for the books. I've tried personally every day to focus on the positive and to be grateful. I think that's helped us get through, and I look so forward to hugs, visiting with family and friends, not having to tell my coworkers they're muted on my 8th Zoom meeting of the day, watching my daughter play varsity soccer, and especially seeing all of you at Temple again. Spring is here, finally some sunshine like Dr. London said, and the end feels near. We're so eager to start doing things that were once part of our normal everyday life. I'm hoping we can start sleeping easier and breathe a big sigh of relief. I'm going to turn it to Rabbi Kaluzny now, and I'll be back to introduce Dr. London.
Fantastic. Thank you all for being here. I think we're all kind of feeling the weight of the year. It's hard to believe, and at the same time, I think we all feel those 365 days. And I had something totally different planned, but Dr. London brought something to mind. And so I want to share it with you. There is a quote, Min hametzar karatiya vaihili lishua. It says, from the narrow spaces, I called out to you and you were my savior, right? So we're talking about God, of course. And what's amazing about this, as we sit right at the precipice of Passover, is the word Meitzar, the narrow places, is the same word as Mitzrayim, Egypt. And so allegorically, you could say, right, that there are so many ways we have almost felt like we have been in our own personal Egypt, right? Our movement has been restricted. We can't be with the people that we want to be with. What's interesting is someone said to me, they don't want to think of COVID as a plague, because the plagues in Egypt were sent as punishments, right? They were sent as warnings. That's not what we're dealing with here. And also the plagues only affected a certain people, and COVID affected literally the entire world. But we are finding ourselves in a narrow space, and we're trying to figure out how not to move backward, how to move forward. And I think we're a little worried about going sideways. And so I think that it's really wonderful that we have Dr. London back with us today to kind of help us navigate each of our narrow spaces. So I hand it back to you, Kari, so we can get right to it.
Thank you. So we are thrilled to have you back with us today, Dr. London. Dr. London is board certified in the areas of child, adolescent, and general psychiatry. He has over 40 years of experience working with children, adolescents, and adults. He's a graduate of the University of Michigan Medical School, and he has been on staff at the Birmingham Maple Clinic and Havenwick Hospital. His areas of specialization include psychiatric evaluation, medication management for children and adolescents, as well as ADD and ADHD issues. Thank you so much for taking the time to be with us today, and we are so grateful to you.
Well, you're very welcome, and this is really, I told Kari and Rabbi that I feel that the infrastructure around Temple really makes it easy to be helpful. I mean, and one of the advices I give people, by the way, one of the pieces of advice I give to people who are depressed, and I guarantee you Rabbi Kaluzny would agree with this one, do something nice for somebody. And that will make you realize that you have not lost your purpose and you have not lost your ability to be helpful. So I'm going to start with a song from long ago. After I took this nice walk today, a short walk with my wife outside, and the sun was shining. The sun is shining, there's plenty of light. A new day is dawning, sunny and bright. But after I've been crying all night, the sun is cold and the new day seems old. That's a song called Since I Lost My Baby. kind of about teenage angst and how even though the sun is shining, that teenager is feeling like still in despair. And for many of us, that may be a familiar feeling. We hear some good news about the vaccine, about the potential for the pandemic one day to be in the rearview mirror more than it is now. And yet, do we feel 100% positive? We've crossed the Red Sea, maybe. We still got a lot of wandering in the desert to do before we get to where we're going. So I just think that we have to start accepting the situation we're in, not give in to despair, but also make it okay to grieve. When you feel sad at a time where you're, quote, supposed to feel happy, you say, what's wrong with me? You know, what determines when we're hit with something that happens in our lives, and we all, guess what? Into each life some rain must fall. We all know that. What happens to determine whether we get depressed, whether we weather it, whether we put it aside, how we deal with it? And, you know, we all have been faced with a lot to deal with, and we're all overwhelmed with all the stuff that we have to deal with. And yet we don't all handle it the same way. We don't all cope the same way, don't all respond the same way. So I'm here to talk about mood disorders and how they relate to this pandemic. And I will say that when something happens to us, what determines our ability to manage it or deal with it? And again, I try to look on things biopsychosocially. It's not just biology, but biology is there. What is your biological vulnerability? For some people, it is very easy for them to become depressed and hopeless. And it may have nothing to do with the strength of their character. It may really have to do with the biology of their chemicals in their brain. For other people, they can get depressed even when nothing has really triggered it. We used to spend a lot of time differentiating what we called endogenous and exogenous depression. In other words, depression that comes from within and the depression that comes from an outside event. And we realized that it ain't that simple. If you meet any patient who is going through a depression and you ask them, have you had any stress in the last 6 months? What do you think they're going to say? No, it's been 6 months of just wonderful, and I suddenly got depressed. I mean, it may feel that way, but there's always something that happened. But the thing is, what you bring to the table has so much to do with how you deal with it. So someone who is biologically sensitive, biologically vulnerable, is going to be affected by this pandemic or anything else that happens in a unique way. And again, so much of what we have to do is self-validation. I'm going through, no matter what everyone else seems to be going through. And again, another aspect of this is my wife and I were just talking. None of our first degree contacts have come down with COVID. Our family are okay. So why do we still feel so vulnerable? I mean, we all know somebody who's gotten it. Most of us know someone who's died from it. Most of us know someone who's been in the hospital. So it is scary, and it's pretty close by. It's not scary like hearing about the monsoon in Pakistan. It's scary like next door. But we still have the feeling, why am I so sad? I've come through this pretty well. Do I have a right to feel this sadness or this whatever I'm feeling? And the bottom line is we all have to we don't want to give in to grief and feel paralyzed by it, but we also want to accept what we're feeling. So the biology has a lot to do with that. The psychology also has a lot to do with how you react. So the psychology of the situation is this: how do I feel about myself? What is my self-identity? What is my self-esteem? What is my personality type? And how does that affect the way I respond to a crisis? For some people, a crisis wakes them up and makes them go to town. And when the crisis is over, they crash. For other people, they do fine as long as it's smooth sailing. And then as soon as there's a big wave, they want to just kind of give up. And some of that may be their psychology, their feelings. And so much of treatment of depression, goes along the same lines. We treat the biological aspects of depression when we try to improve the chemical imbalances that occur in patients who are vulnerable. We treat the psychology of depression when we work with patients on their mindset, cognitive behaviorally, so they can understand how their type of thinking affects their ability to function and focus on a certain event. And then we got the social part of the biopsychosocial, and that is what is happening around us. And my God, it's been crazy. And also, what is the social network I have around me? This is where we all find, like, I went to see my doctor today for a physical. And sometimes I feel my doctor doesn't understand me exactly, and I don't know that we understand each other. We don't have the same politics, I don't think. But what I said to him, and I really meant it, is that I always know that if I have a need, he'll be there for me. And again, sometimes your family drives you up the wall, all of us. But my God, who do you turn to, when you're in the middle of a crisis, if not your family and friends? So we all have this biopsychosocial network, aspects of our lives that affect the way we respond. So for some of us, when we respond to a crisis, it's simply an acute sadness or an acute grief. And then we kind of soldier on, or however we call it. And we're the type of people who respond to that. And that almost wakes us up. And maybe later on, we wait and we crash after we realize what we've been through. For others, we just fall apart in a crisis. And I'm not saying that you should feel happy about that, but I think Socrates said long ago, know thyself. He did not say change thyself. He didn't even say accept thyself. He said know thyself. And Socrates is a pretty good philosopher. So I take from that to mean know who you are and try to work at accepting who you are and use that knowledge to figure out how you're going to deal with what you're dealing with. And of course, like the Serenity Prayer says, change what you can, try to accept what you can't, and find the wisdom to know the difference between the two. So for some people, it's just an acute sadness or a grief reaction that they get over within a short period of time. For others, it persists and they find themselves overwhelmed. And many of these are people with a biological vulnerability towards depression. And in that situation, many times it may require medication to help you deal with the acute mood disturbance. If you are at a point where you are so depressed and so sad that you cannot get out of bed in the morning or you can't face what you have to face, then this is more than just a acute reaction to something. This is something that's have biological. That's when I said exogenous or endogenous. It doesn't matter if it's triggered by something outside of you. It still may require some type of biological treatment. And we have, thankfully, many medications that are quite helpful for people who are depressed. They're not a panacea. They're not the answer to all of your life's problems, but they sometimes can get you to the point where then you can work on the problems. I mean, it's kind of like if you're trying to climb a fence and you can't get over, you get a boost and suddenly you can get over that fence. The antidepressant may be the boost you need to face your problems. And then maybe you need to see a therapist or talk to a family member or talk to a rabbi or, talk to your wife or husband and maybe then, or a friend, and that will allow you to get through it. Often it's a combination of treatment, various kinds of interventions, including standard treatment like psychotherapy, often cognitive behavioral for depression, or interpersonal. There's two types of therapy that have evidence behind them for depression. One is cognitive behavioral therapy, and the other is interpersonal therapy. That doesn't mean that family therapy and psychodynamic therapy aren't necessary or helpful. It just means that for acute depression, it's probably more important to focus on a more evidence-based treatment. But if you also have a lot of issues from your childhood, you may well need psychodynamic or Freudian type therapy. You may certainly need a form of family therapy if part of the problem is that your family's living in the house together and you can't stand each other right now. You got to find a way to deal with each other because nobody's going anywhere, right? So the point being that it's not a one-size-fits-all model. And from that standpoint, any psychiatrist or mental health professional worth their salt is going to do a comprehensive evaluation rather than just kind of start throwing darts at the dartboard. You got to understand what's going on. We're also here to talk a little bit about bipolar disorder, which is another whole other entity in which and if you think about bipolar disorder, where people have periods of mania or highs or irritability and lows, one of the truisms is this: people who are manic depressive, when do you think they seek help? Most of the time they seek help when they're feeling depressed. Because when they're feeling good, they're saying, this is great. Leave me alone. I love feeling this great. And like I know everything in the world. Unfortunately, what goes up must come down. And those highs often lead to lows. But the key is this: if you don't do a careful analysis of a patient's mood diary over time, then you mistakenly treat this as if it's an acute depression, and you forget that it's a bipolar depression, and the treatment is very different. And the things that we give patients for depression, antidepressants, and some of the other things we do, may in fact backfire and make things worse. So it's so crucial to look at the whole big picture. Major depression is where someone is in a depression of major proportions. And there's another form of chronic depression that's called persistent depression. We used to call it dysthymia. And what that is a lower grade depression that's more permanent or more ongoing. It doesn't mean it's always there. We used to believe, again, that only major depression responded to medication. We now realize that even this low grade persistent depression can sometimes respond to medication. But one thing we've learned over time is this: if you have a recurrent depression, 2 or 3 depressive episodes, you probably are going to need to stay on some type of medication permanently. It's probably best that you do. It doesn't mean always that's the case. If you have one intensive depression, you may well be able to get by with treating it for 6 to 9 months and then slowly weaning off medication, and you may be okay. But we always have to kind of look at the big picture, and you have to be followed carefully. But the point being that one size doesn't fit all here. What I'm trying to teach you is that treatment is not, that's why it's so hard to write a book, because every situation is different. And I learn from my patients. What worked for one person didn't work for somebody else. I learned from having 3 kids. What worked for one kid didn't work for the next one. And I was still the same parent trying to do it. I just understood this kid, and this one, I can't understand where he's coming from. And now that I have 6 grandchildren, you can just imagine how confused I am. So we all know there's biological complaints that people have when they're depressed. Depressed mood, lack of enjoyment in activities, changes in sleep and appetite. And sleep is one thing that we got to talk about a little bit. I don't know about you guys, I've been having a lot of intermittent sleep issues. Don't ask what I was going through when the election was going on. But this pandemic has also led to a lot of times where I find that's when I'm quiet and nothing else is going on around me. I don't have the idiot box on. I'm not looking at my screen. Suddenly, it all hits me. And sometimes what I've had to do, frankly, again, talk about knowing yourself. I've had to get up in the morning and say, or get up I'm still getting up like at 4 or 5 in the morning and say, I'm not sure you're going to get back to sleep tonight, Jeff. So what I do is I have found what works for me, and it may not work for you, it may work for you. I put on some music and I try to sleep while listening to music because the music drowns out some of those voices in my head. And for me, that works. It may not work for you. Again, you need to figure out who you are and what works for you. What I found did not work for me is saying to myself, what's wrong with you? Go to sleep. Other people have it much worse than you. Why are you up? Believe it or not, that didn't put me back to sleep. What that did is just wake me up more and say, you know, what's wrong with you? And for many of us, I think we're saying that to ourselves. And what I'm encouraging you to do is validate what you're feeling, whatever it is, but then also don't get paralyzed by that and say, what can I do with that knowledge and how am I going to move on from here? This might be a good time to take a break. Kari, do you have some questions or some things?
I do. And thank you for that advice. And I'm so glad to know that I'm not the only one that's intermittently
No,
sleeping.
you're the only one, Kari. We all agreed to get together here to tell you that.
Yeah, thanks. This is an intervention, right, for my sleeping.
Right, exactly, right.
We do have a couple questions. First one, very interesting, and I know a lot of parents are struggling with this. Parenting our ADD teens with newfound mood swings about turning off the screen and how to appropriately enforce the necessary breaks of technology.
Oh man, that is a great question.
Yeah.
Well, I've just read a number of articles about this, and one of the things my thinking I think has changed through time as, first of all, as we see the ubiquitousness, does that mean that's all around us of screens? I don't think, you know what, the genie is out of the bottle, guys. I hate to break it to you. I think, and I've read a lot of the articles have suggested this. Let's accept that screens are here to stay. Let's figure out how to use them in a positive way.
Mm-hmm.
Let's make some compromises with our kids about when to use them and and how to use them. Obviously, it doesn't mean you give carte blanche to your 8-year-old to go on the internet, but to say that, you know, to tell a 12-year-old you lost screen time for the next week, you lost any ability to use your iPad for the next week, your iPhone for the next week, you might as well cut off their arm. So you have to deal with it as a reality. It is here, and you have to work with and what I would do is take a deep breath and say, this is a tough time. This is a tough one for me. It's going to take me some time to figure this out. We need to sit down together and talk about this. I'm not saying that I'm still not the parent. I'm still going to make the rule, but I'm going to make it with your input. I'm going to find out what you feel you can do without and what you can't do without. And I'm going to point out to you that I have lived longer than you. And even though I don't understand computers as well as you, I do have some knowledge about life. And I think that the screens, I understand how valuable they are to you, but there's going to have to be some limit put on it. And we're going to have to discuss that. Why don't you go out and think about what you feel what's reasonable to you? I'll think about it, and then we'll come back and talk about it. You're giving them the message that you're going to take their input. You're not saying that it's a democracy, because it ain't, but you're saying that you understand how important it is to them. And that reminds me of another issue, is how to differentiate ADHD from mood disorder. And it's not that easy sometimes. First of all, many of my patients come with more than one diagnosis. I hate to break it to you, but they haven't read the DSM and come with just those 5 symptoms. They often have both problems. So it's not either or. You can be ADHD and also depressed. A lot of times, if their ADHD is controllable, and often with medication, that can help, but the mood disorder may still be there, and you may have to treat both disorders at any one time. But you first have to figure out what are you dealing with. First of all, are they having intense feelings of irritability or flight of ideas where they feel like they're on top of the world and can change the world and aren't getting any sleep? They're probably manic. They're probably not ADHD. And you always have to kind of differentiate between mood disorder, ADHD with mood disorder, and ADHD without mood disorder. And it's not that easy sometimes. So I guess the most important thing is to like most times, is to stop and think. Give yourself time. Don't feel like you have to handle every problem in the moment. People, how many times do parents get in trouble with, you're grounded for the rest of your life? Well, good luck enforcing that one. So stop and think, model for the patient. What do you want to model for your ADHD kid? I feel right now like I just like to throw you in your room for the rest of your life, but I'm not going to do that because I know that wouldn't help you. And I know that's not what you need. I got to give myself some time to think about this. I'm so angry with you right now that I just don't trust myself to sit down and talk to you. You give them a message. It's okay for you. Anybody in the room can ask for time out, right? That's got to be a rule. How much problems would be saved if I didn't open my mouth sometimes and stopped and thought? And I know better, but I still do it. Go ahead, Kari. What's next? Got other questions?
We have one other one. This is a really good one too. As we return to more norms, our friends and acquaintances that are so uncomfortable breaking the cycle of staying home safe and sound, any suggestions to help our friends slowly return to normal?
Oh, wow. That's the perfect question. That's all right. Well, I got a song I wrote about that, so I'm going to use this as an opportunity to sing my song. Sometimes I can say more with my song than my brilliant prose. One step back in the world, sweet Moses, one step back to the world. We've been staying in our house, but it's time for taking one step back to the world. Waiting for the word from the gov and others about schooling for our boys and girls. How to keep those children safe and learning one step back to the world. How can we know what tomorrow brings? 'Cause we've been waiting for better hopes and things. We're searching for answers to all the questions that we ought to ask. So it's time for a leap of faith, but don't forget your mask. I'm going to stop there. So
Excellent.
the point of this is that it is one step back to the world. And we all have to slow down. And again, remind of what I said earlier. How you approach this pandemic has a lot to do with what has happened before in your life. If you are someone who has had relatively smooth sailing, this has probably hit you like a ton of bricks. If you are someone who's used to roller coaster rides, this may be just another roller coaster ride that you're taking. If you are someone who loves being at home, is socially very anxious, you may be doing just fine staying at home. And the scary thing for you is somebody's saying tiptoe out. And again, what you may need to do is do it one step at a time, somebody holding your hand, and maybe with a lot of help.
Baby steps, right?
If you are someone who can't stand being at home, this has been like, you've been like, like in a closet, my God. And the problem is, how does one person talk to another? I mean, we're having so much trouble in this country talking to people on the other side of the aisle, aren't we? And in this same situation, I mean, my wife and I are closer together than we have been on most of our ideas, but about this issue, we are struggling. I want to just kind of get out. She wants to take it slow and really watch it. And I don't think one of us right and one of us is wrong. Although my wife would disagree with that. But the point I'm making is that we all have to listen to each other, and we all have to we have to hear each other. The most important thing is listening. And so when you hear a friend who says, I just don't know that I can do this, you got to say, I hear you. I hear how scared you are. And I think we all know, though, that we have to start tiptoeing out of this, or we're going to be stuck here. So is there a way that I can help you do that? If you simply make fun of them or say you're being a nervous Nelly or whatever you say, that's not going to work. On the other hand, the friend who is saying, what do you mean you want to go to a concert tonight? You got to be crazy. Again, we have to listen to each other and try to be understanding of how our different psychologies and our different biologies affect our response to this. And I guess that's one thing I would just say is work on your listening skills. I recently joined an organization called Braver Angels. And Braver Angels attempts to bring people on both sides of the aisle together and teach us how to listen to each other. It sounds like a great idea, and it is a great idea, but one of the first events I went to was a talk about the election and the, voter, the whole issue of voting. It was so hard for me to listen to people on the other side and not want to jump in with are you kidding me? And again, we all have to learn. If we are in this together, and those of us with different kinds of personalities are going to find a way to live together and get along together, we are going to have to listen to each other. So that's the best advice I can give you.
It's wonderful advice. And I always say we have to encourage with love and not judgment.
Yeah, very good. That's well put.
Yeah, and it's exactly what you said.
Psychosocial factors are very important in the treatment of depression. And we also have to look at, we have protective, it's not just the stress, it's also, there's protective factors in our lives. If this hasn't made you a little bit thankful for what you have, then you really haven't been listening. If you haven't kind of realized in some ways by this whole thing of all the stuff we took for granted, oh my God. I mean, it kind of reminds me of when you have a bad cold and you say, you know what, when I shake this cold, and I know I'm going to, I am going to kiss the ground every day I wake up not sick. Well, how long does that last? Your first hangnail and you're saying, darn, I can't believe this. It's amazing how quick we are to forget what we've been through. And one of the things that tests us in this situation is our uncertainty about our capacity to handle this. Many people are saying, if we had known last March that we were going to be sitting here this March on Zoom, would we have signed up for it? Not that we had a choice, but what we did is what we usually do. We handled March 31st, and then we handled April 1st, and then we handled April 2nd. I always tell my patients, you do not have to solve your problem today. You just have to get through today. And I remember a show on television when I was a kid about a kid who had committed suicide. And the take-home message was, we just needed to tell him that he didn't need to solve his problem. He just needed to get through the night. And you can't talk about depression without talking about suicide. Unfortunately, there's been a lot, our country has been, prone to so much violence, both self-directed and other-directed. And it's a very, very sad statement about, one of the things that I feel very sad about in terms of, as you look around us and see the number of people who obviously are in such pain. And many times they direct it strictly at those they love. And other times they just strike out at some target, that I don't know exactly why. And, we also feel so sad, obviously, for the innocent bystanders who happen to be in the line of fire. That's one problem I have with, and I've talked to my rabbis about this, is, that people who say, thank you, God, for what you've given me. The other side of that is somehow saying, if I don't have stuff, does that mean God didn't like me? Or if I am sick, does that mean that God thinks that I deserve this? And I hope not. I mean, I really love that book that came out so long ago about how to look at God when a time of illness, of trying to say that God is there to help us through this, rather than he didn't inflict this on us. He or she didn't inflict this on us. God is there to help us through it. And that's the God that I hold on to. So anyway, the talk of suicide is something we have to talk about. It's really, again, this is where your listening skills really come in. you have to be able to be willing to hear how bad somebody's feeling. And for so many people, they're looking for somebody who's willing to listen to them. The other day I was feeling bad about something, and I realized there were not that many people who I felt I could really tell what I was feeling. As much as I have great friends and I have a loving wife and a wonderful family, on some level I was judging myself for what I was feeling. I was saying, who could I really tell about this without feeling stupid or without feeling judged? And I realized that thankfully I did have a few people that I could talk to about it. And it may be different people for different things. But if you have someone in your family who is feeling these kinds of intense feelings, you have to, first of all, be willing to listen to them. You have to not try to talk them out of it. Certainly, you want them to feel like this is not the end of the world. We all had that when I was a teen. If teenage, the way you felt as a teenager, the way you felt the rest of your life, I don't know if any of us could have dealt with life. But thankfully, we all found that it was not as bad as our worst day. You know, that day that you went to school and threw up, or that day that you went to school and forgot your homework, or that day you went to school and one day I had a hat on and they took my hat and they were throwing it around the room. That was not every day of the rest of my life. So for many people, it's reassuring them, you will get through this. I'm listening to you. I'm not telling you to stop feeling sad. But if they truly are feeling like ending their life or having serious thoughts of that, the first thing you got to do is listen to them. The second thing you do, if you really feel that it's beyond your expertise, is to reach out for some help. Call a family friend. I mean, I have friends who call me and say, what do you think I should do? And, you know, sometimes I'll get involved directly, and sometimes I'll just say, you know what you should do is go to the emergency room, or what you do is call your doctor. It's amazing how sometimes people are afraid to call their doctors. If you have a doctor that you can't call when you're sick, you got the wrong doctor. I hate to break it to you, because that's what I was saying about my doctor. I don't agree with him on everything, but I know if I'm sick and I call him, he'll answer the phone. And you need a doctor who will be there and who will talk to you. And maybe the doctor will say, this is beyond my expertise. You need to go to the emergency room. And obviously, 8 months ago, that was not an easy thing to do. I think now it's a little easier. COVID is certainly still in the air. It's still everywhere. But there's a little bit of a sense that you can go to an emergency room and they know how to keep you safe. But the point is that suicidal feelings are real, and they are not something to be simply patted on the head about. There's something that really have to be taken seriously. I always tell my therapist who I'm supervising is that any patient who's depressed, you need to ask about that every session. And you have to ask about it in a way that's open-ended. You don't ask about it by saying, well, you haven't been feeling suicidal, have you? Because guess what? They're going to say no, because they know you don't want time or you don't want to hear about it. But we all have to be willing to listen to each other, even when things are bad. Substance abuse is another issue that we always have to talk about when we talk about mood disorder. First of all, again, it's not one to a customer. You can have substance abuse and depression and ADD. But substance abuse is like pouring gasoline on a lighted fire. When you have substance abuse in the mix, everything is thrown off. And a lot of times when I have patients with both mood disorder and substance abuse, you got to figure out what to treat first, or you may have to treat both. If you don't get that substance abuse under control, your mood medicine isn't going to do anything. If you don't get that mood under control, guess what? Why do you think they're going to the substances? So you got to, again, listen, ask the question, ask an open-ended question, and not be afraid of the answer. We all are guilty of that, of saying, oh, it's not that bad, is it? I mean, that's part of what we do offer people. One of the things that everyone offers is to say, come on, we're here, we'll get through this. That's good to say that. But what we don't want to do is to minimize what somebody else is feeling. So I thought maybe I would talk a little bit about bipolar disorder. I've talked a little bit about cognitive behavioral therapy, but I want to just say a little bit more about that before I move on. So cognitive behavioral therapy is a form of therapy that focuses on how thoughts and feelings and behaviors are intertwined. the way we view ourselves and the world affects how we feel in a given moment. And again, a lot of it has to do with our typical way of dealing with things. And you think about knowing yourself. Again, remember Socrates again. Am I someone who is, when something happens to me, that I immediately think the worst? Well, instead of putting yourself down for that, say, I understand that about yourself, and then say, now what do I do with that knowledge? So again, so much of it can be helped if you can say, instead of hating yourself for what you feel, instead of just dismissing what you feel, to accept what you feel and be a good therapist to yourself. But what cognitive behavioral therapy does is when someone is unable to change those patterns, this all or none thinking or overgeneralization or jumping to conclusions. Most of us do it about some things, but some people do it so consistently that they can't get over the hump. They are just constantly spinning their wheels. This is where a cognitive behavioral therapist comes in play. He or she listens to you and helps you realize what you're doing, understands it, and then helps you develop a technique for taking that next little step. Again, remember that one step back to the world thing. One little step is where it starts. You know, I had a patient who taught me so much about dealing with anxiety. She could not go anywhere because she was so afraid that her IBS would kick in and she would have to run and find a bathroom. And she lived in terror of not being able to find a bathroom. And then one day she said, you know what? I'm tired of not being able to do things. I can't stop this feeling, but I'm going to have to go even with this feeling. She taught me so much because it wasn't like she had this sudden realization that the feeling was going to go away. She just said, damn it, I am tired of not being able to do things. And I'm going to go with all this crap I have going with me. I'm going to take that with me and still go. I'll find a bathroom. I'm not going to be happy about it, but I'm going to feel a lot better if I can go on that trip that I wasn't able to go on. And sometimes that's what it takes, a belief in yourself and to say, I deserve this. And this is what's going to take a lot of us to get out of the house, is to say, I'm going to take some risks. I'm going to take careful risks. I'm going to use experts to help me guide my risks, but I'm not going to feel 100% comfortable about it, but I'm going to do it. And you start finding out that you go to the grocery store and you don't fall dead. And the next step is you're able to maybe go shopping for a half hour. And maybe the next step is that you're able to go carry out some food. And gradually you work your way back to it's not normal that we're looking for. It's the new normal. It's the crazy new normal that we're looking for. Guess what? We're not going to go any more than if you've had a horrible loss in your life. You are not going back to life before that. That's always going to be there. But you can incorporate it and figure out how to move on. And that's the name of the game, right? That's what we're all doing. We are all, and I use a lot of platitudes. We are all the imperfect children of imperfect parents. If you want to go back and rethink and wish your parents could be perfect, that's a waste of time. Instead, do what I try to do, is to say, my parents were imperfect human beings, but they sure loved me with all that imperfection. And they loved me despite my imperfections. Another type of therapy that has been very useful is called interpersonal behavioral therapy. Again, it's a longer-term manualized therapy, which attempts to look at how relationships with others, learning specific strategies to improve communications. Again, I'm not downplaying everyday talking therapy where you simply talk about whatever on your mind. But when you talk about evidence-based, these types of therapies for depression have been the most effective. Medications, I think I've talked about. I could spend a whole talk on medications, and maybe one of these days, maybe that's something we could do for another talk. Rather than for me to try to do a 5-minute view, I will say this: the medications we have are very effective, but they are never the whole story. They can really improve mood. They can help with sleep. They can help with anxiety. They can help a lot, as we talked about boosting your energy level and helping you be then able to face your problems, but they're never the whole story. And the other thing is, there are things beyond medication. When you look at evidence bases for treatment of mood disorder, what are high on the list? Exercise, sleep, diet. These are not just adjunctive things. These are treatment. That is treatment for depression. Exercise. It's one of the things that actually evidence shows actually works. And many of us have put on some weight with being at home and having the snacks call out to us all day long. We really have to, again, start by accepting the problem. Every step, every 12-step program, the first step is I got a problem. And I'm not going to let it define me, but I'm also not going to run away from it. Do I want to talk about bipolar a little bit, Kari? Or do we have any other questions?
We have a bunch of
We have some questions, yeah.
Okay.
bunch of questions. One, as you were talking, and it's long, so bear with me.
Go ahead.
Healthy to exercise multiple times a day to deal with stress and anxiety? And how do you find the time to take things slow and relax if you have anxiety, especially with huge life changes that won't let you slow down? For example, buying a house, working a full-time job on top of the pandemic, and having social anxiety.
Well, it ain't easy. There's no easy answer to that question, obviously. I think the key is scheduling it in the way you schedule other things. Saying, I know, like last night, I was thinking, if I don't get a good night's sleep, I'm not going to be much use to this talk today. Now, I don't say that just to berate myself, but if I don't go for a walk, it's better right now for me to go for a walk than it is for me to handle that next phone call. I better go for a walk before I handle the next phone call, because it's part of accepting who you are and accepting what you need. If your kids say, should I be in school all day and stop and never take a break? What would you say? Nobody would say, of course, you need to take a break. Well, guess what? You're no better than them, and you need that break. Maybe it's a walk. Ideally, reward yourself with something other than food. Try to reward yourself with a walk. Reward yourself maybe with some meditation time. Reward yourself with a glass of water. Reward yourself with listening to some of your favorite music, and say, I'm doing this because it'll make me better at doing that next thing. And otherwise, I'm not going to be good to anybody. I mean, that's just common sense, but it's so hard to listen to. I wish I was better at it, talking to myself about it.
No, that's great advice. Okay, next we'll do with working from home. The majority of communications are in writing. Sometimes an email can come across very harsh. How do we, the recipient of the short, seemingly harsh request, rise above and respond with kindness instead of biting back?
Yeah, wow, those are great questions. We talked earlier, Kari, about the idea of working from home is another way of saying living at work. And I think all of us have had to learn how to compartmentalize it. It is not easy to do. And again, the first part of every problem, accept that the problem is there. This is a problem for anybody. Instead of telling yourself you're silly for feeling that way, say, of course you feel that way. So again, what I have found, one of the problems I have is I am impulsive. And when I get an email, especially a harsh email, my wife will tell you, I really want so badly to just fire back something. And I really have had to talk to myself a lot about that and say, you do much better when you give it some time. It's so hard for me to leave that in my inbox and know it's there for me to have to deal with. What it really is I want it out. I want it out of my inbox. It's kind of like somebody writing a message to you saying you're no good, and you're going to leave that there. It's not easy to do. Somebody writes a message saying how wonderful you are. I'd leave that there forever, the whole day, and keep looking at it. But somebody wrote you a message and say, deal with this, buddy. Well, it's natural to want to respond. And again, we're really trying to model what we want other people to do. If you are modeling back by saying, I'll show you mad, you think you're mad at me, I'll show you mad, do you really think that that's going to end the conflict? And again, if you do mistakenly respond immediately, what are you going to do? Just like with your kids. If you yelled at your kids, what you do is you say, you know what, I'm human and I really feel bad about that. That was the wrong thing to do. I always tell you to do this and I did that. I just wish I was a more perfect person. All you can do, you can't undo a mistake, but you can apologize for it. I think you have to try to give yourself time. You got to take a deep breath. You got to really use discipline, self-discipline. Discipline is a dirty word. It used to mean discipline, what means spanking your kids or smacking yourself over the head. I beg your pardon. Discipline is self-discipline to be able to stop yourself from doing that. That's what really discipline is. Mm-hmm. And so give yourself, say, I'm the kind of person, you could even write back to the person. I'm the kind of person who tends to respond very quickly to an email like yours. I hear how angry you are. I really need to give myself some time to figure out the best way to respond that helps the situation. I think that would be a great thing to do. And why don't I do it more often? Sounds like great advice. Why don't I take it? But look, we're all human, but I really think that's the kind of thing. If you feel like you need to respond with something like that.
Take a step back, think about it, and then kill them with kindness.
Well, but maybe you don't kill them with kindness. Maybe you say, I was really hurt by what you wrote.
Sure.
And I was ready to respond in kind. And I realized that wasn't going to help anything. And I do hear how angry you are, but I still feel like you kind of took it out on me. And I don't know that I deserve that, but I'm trying to listen to you. I mean, you can have that kind of dialogue. You're not saying, I'm going to be the repository. You get to dump on me all you want, but you are also saying that I'm not going to just meet you and see you and raise you.
Right. I have one more quick question, and then I know you have something special for us.
Right, I know. Yes.
Time went so fast. From sitting home for so long, lack of motivation has set in.
Yeah.
How do you change that? Not caused by depression, though.
Yeah, I think you have to really start with one step at a time. It's kind of like when you first go to a swimming pool after you haven't been swimming for 10 years. And you used to swim, 12 laps. And you try to swim one lap and you just completely can't do it. And you go, oh my God, what happened here? Well, what do some people do? I'm not going swimming anymore. Other people do this. I'm going to swim a half a lap today. I mean, you got to give yourself permission to meet yourself. What do we always say about our kids and about anybody? Meet them where they are. Mm-hmm. So you are someone right now who is a slug, who has just lost motivation. So what can you do to give yourself the message that you can start taking little steps? The only thing you can do that I know is to take one step. And again, that message may seem silly. It may seem silly to go out and go walk around your house or walk around your basement and listen to music for 5 minutes. My God, I can't do that. I used to be a world-class athlete. Yeah, right. But my point, you know what I'm saying. You really have to meet yourself where you are. So much of this is about self-talk, isn't it? So much of this is about how we talk to ourselves and how we can use that. I want to say one thing about bipolar disorder. Bipolar disorder is something we really need to take time to evaluate. Again, as I told you before, many patients with bipolar come in depressed. And if you just treated the depression, you're going to do them not a disservice because they really need a different kind of treatment than a patient with depression. They may need lithium or a mood stabilizer. They may need a different kind of medication for their depression. They need a different kind of therapy. They need a therapy that's focused on keeping their moods in check. Because a lot of bipolar is by preventing the ups and downs, you prevent future episodes. So bipolar is a whole entity unto itself. But what I will say is this, that with bipolar disorder, a mood diary and making the diagnosis over time, and you cannot do it from a snapshot. You can only do it from a videotape, if you understand my metaphor. You've got to look over time. And when you have a patient who's in here with depression, and they tell you that 6 months ago, I was on top of the world and I didn't need any sleep, and now I'm sleeping 12 hours a day, that is a red flag. If you treat that as depression, you are in trouble. If you realize that that patient has a bipolar disorder and may need treatment for their moods well beyond this acute episode, you're going to do that person a lot more of a solid than you are by treating him as if the depression is the only problem that he has. There's a thing called kindling in bipolar disorder. By that I mean that the more episodes of depression and bipolar you have, the more episodes you're going to have. So if we can short circuit and lower these episodes down, if we can make them smaller. And by the way, you don't have to have a full-blown manic episode to be a bipolar. You can have what's called a hypomanic episode with a slight mania. And if you can even that out, you can do a lot for the future. The other thing is that we've learned there's a subgroup of teens who have something called DMDD, which is a form of mood disorder and disruptive mood regulation disorder that's not early bipolar. We used to call these kids atypical bipolar. We now realize that's not what they are because they don't go on to develop bipolar. They are very seriously affected, but they need a different kind of treatment. And again, the point is a diagnosis, take your time, understand what's going on. Don't shoot from the hip. That's good advice about one of the take-home messages of this whole talk has been stop and think. Even when you feel like you have to react immediately, a lot of times you may not have to. And give yourself permission to be human, right? So I want to end with something that we have, one of the things that we've had to do is adjust to this pandemic. So everybody's on mute, right? Okay, all of you on mute are going to join me. You're going to be my chorus. We're going to do a song, and here's your part. Are you ready? Your part is this. Zoom, Seder, 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 Zoom, Seder, Seder, Zoom, Seder, 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 Zoom. Thank you. Once again, we're together on Zoom, Seder, Seder, 'cause we can't all be in the same room, Seder, Seder. We are still not allowed to eat bread, Seder, Seder, and put jam on matzah instead, Seder, Seder. The Haggadah still tells the same tale, Seder, Seder, of the children of Yisrael, Seder, Seder. The four-question asker's still cute, Seder, Seder, but the rest of us now are on mute, Seder, Seder. It seems even more important this year, Seder, Seder, that we cherish the ones we hold dear, Seder, Seder. Though we can't be in person to share, we can virtually show that we care. Zoom, Seder, 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 Zoom, Seder, Seder, Zoom, Zoom, Zoom. Have a happy Pesach, everybody, and be kind to yourselves. And remember, we're all in this together, okay?
Thank you.
Thanks for inviting me.
Thank you. Thank you so much. I've literally been taking notes.
Well, you guys have appointments, so I feel free to hit the road, but I appreciate all the support. I think that was everything I wanted it to be. I was very happy with the message I got across.
Truly, I took so much away from that. And a friend once called, like, the whole idea of giving yourself permission that just because other people have problems. Someone once called it the suffering Olympics. Like, you don't know, you don't have to get the gold, or you don't have to say, well, I only deserve the bronze. Like, you're welcome, Elisa. Thank you for being with us. Well, I do have to go, Dr. London.
Okay, you guys go ahead and let's do this again. If you want to do another topic like medication or like something else that comes up, feel free to call on me in a few months. I'd be happy to do it again. Okay.
I will call you. Thank you. Hugs.
Have a good holiday. Take care.
Happy and meaningful.
Bye-bye.
Bye-bye.